Alzheimer's disease is a thief. It steals memories, robs independence, and ultimately takes away the very essence of who we are. It is the most common form of dementia, a general term for memory loss and other cognitive abilities serious enough to interfere with daily life. Alzheimer's disease accounts for 60 to 70% of dementia cases, casting a long shadow over our golden years. This progressive disease primarily affects older adults, but it is not a normal part of aging. It is a devastating illness that gradually destroys brain cells, leading to a decline in thinking, reasoning, and behavioral abilities. This decline severely impacts a person's ability to function independently and engage in meaningful relationships. Alzheimer's is a complex disease with no known cure. However, the earlier it is diagnosed, the better the chances of managing symptoms and slowing its progression. Early diagnosis allows individuals to access available treatments and therapies that can help preserve cognitive function for a longer period. Understanding Alzheimer's disease is crucial for individuals, families, and society as a whole. By raising awareness, promoting early detection, and supporting research efforts, we can strive to lessen the impact of this devastating disease and improve the lives of those affected by it. In the fight against Alzheimer's disease, early detection is paramount. This progressive condition, which affects millions worldwide, can be devastating not only for those diagnosed, but also for their loved ones. The journey through Alzheimer's is challenging, but knowing sooner can make a significant difference. Just as with many other health conditions, the sooner we identify and address the issue, the better the potential outcomes. Early detection allows for timely medical intervention, which can help manage symptoms more effectively and slow the progression of the disease. This proactive approach can lead to improved quality of life and extended periods of independence for those affected. Recognizing the subtle warning signs and seeking prompt medical attention can make a world of difference in the lives of individuals and their families. Symptoms such as memory loss, confusion, and difficulty with everyday tasks should not be ignored. Early medical consultation can lead to a more accurate diagnosis and a tailored care plan that addresses the specific needs of the patient. Early diagnosis of Alzheimer's allows for earlier intervention, which can significantly impact disease progression. Interventions may include medications, lifestyle changes, and cognitive therapies that can help maintain mental function and delay the onset of more severe symptoms. This early action can provide a better quality of life for both patients and their caregivers. While there is no cure, available medications and therapies can help manage symptoms, slow cognitive decline, and improve quality of life, especially in the early stages. These treatments can help patients maintain their independence longer and reduce the burden on caregivers. Additionally, support groups and counseling can provide emotional support and practical advice for families navigating this difficult journey. Early diagnosis also provides valuable time for individuals and families to plan for the future, make necessary legal and financial arrangements, and access support services. This planning can include creating advance directives, establishing power of attorney, and exploring long-term care options. Being prepared can alleviate some of the stress and uncertainty that comes with an Alzheimer's diagnosis. Traditionally, diagnosing Alzheimer's has been a multi-step process involving cognitive assessments, neurological exams, and brain imaging. These methods, while effective, can be time-consuming and sometimes stressful for patients. However, they are crucial in providing a comprehensive understanding of the patient's condition and guiding the treatment plan. However, promising new diagnostic tools are emerging, including blood tests that can detect specific biomarkers associated with the disease. These advancements represent a significant leap forward in Alzheimer's research, offering a less invasive and potentially more accurate means of identifying the disease in its early stages. Early detection through these innovative methods can lead to earlier and more effective interventions. These advancements offer a less invasive and potentially more accurate means of identifying Alzheimer's in its early stages. With these new tools, healthcare professionals can diagnose the disease with greater confidence and begin treatment sooner, which can make a substantial difference in the patient's prognosis and quality of life. If you or a loved one are experiencing persistent memory problems or other cognitive changes, it is crucial to consult a healthcare professional. Early consultation can lead to a timely diagnosis and the development of a comprehensive care plan. This proactive approach can help manage symptoms more effectively and provide the necessary support for both patients and their families. Don't dismiss these symptoms as simply part of normal aging. While some memory loss can be a natural part of getting older, significant changes in cognitive function should be evaluated by a professional. Understanding the difference between normal aging and the early signs of Alzheimer's is essential for seeking the right care and support. Early detection and intervention are essential for navigating the challenges of Alzheimer's and ensuring the best possible outcomes. By recognizing the signs early and seeking medical advice, individuals and their families can take control of the situation, access necessary resources, and plan for the future with greater confidence and peace of mind. If you're enjoying this video, please consider hitting the like button, share the video, and of course we would love for you to subscribe. To truly comprehend the devastating effects of Alzheimer's disease, we must delve into the intricate workings of the brain. This complex organ, responsible for our thoughts, memories, and actions, is profoundly affected by the disease. Understanding how Alzheimer's impacts the brain's structure and function is essential to grasp the full scope of its effects. Alzheimer's disrupts communication pathways within the brain, leading to the death of brain cells and the progressive decline in cognitive function that characterizes the disease. This disruption begins at the cellular level, where neurons, the brain's communication cells, are affected. One of the hallmarks of Alzheimer's is the accumulation of abnormal protein deposits in the brain, known as plaques and tangles. These deposits interfere with the normal functioning of neurons, leading to their eventual death. Plaques, composed of a protein called beta-amyloid, build up between nerve cells, disrupting their ability to communicate effectively. This buildup is one of the earliest signs of Alzheimer's and can begin years before symptoms appear. Tangles, made up of a protein called tau, form inside neurons, interfering with their essential functions and ultimately leading to cell death. These tangles twist the internal structure of the neurons, causing them to collapse and die. As these plaques and tangles accumulate, they disrupt the intricate network of communication within the brain, impairing memory, thinking, and behavior. This disruption affects various brain regions, each responsible for different cognitive functions. The brain gradually shrinks as brain cells die, and regions responsible for memory, language, and reasoning are particularly vulnerable to damage. This shrinkage, or atrophy, is a visible sign of the disease's progression. While the precise causes of Alzheimer's remain elusive, researchers believe that a complex interplay of genetic, environmental, and lifestyle factors contributes to its development. Factors such as age, family history, and certain genetic mutations can increase the risk. Understanding the biological mechanisms underlying the disease is crucial for developing effective treatments and prevention strategies. Researchers are exploring various approaches, from targeting beta-amyloid and tau proteins to investigating the role of inflammation and immune response in the brain. By unraveling the mysteries of the Alzheimer's brain, we can pave the way for a brighter future for those affected by this devastating illness. Through continued research and innovation, there is hope for new treatments that can slow or even prevent the progression of Alzheimer's, offering a better quality of life for patients and their families. Alzheimer's disease is a progressive illness, meaning its symptoms worsen over time. This gradual decline can be challenging for both the individual and their loved ones, as it often requires adjustments in care and lifestyle. While the rate of progression can vary from person to person, understanding the different stages of the disease can help individuals and families recognize the signs and seek appropriate care. Knowledge of these stages can also provide a sense of control and preparedness, allowing families to make informed decisions about treatment and support. Early diagnosis and intervention are crucial for managing symptoms, slowing disease progression, and improving quality of life. By identifying the disease early, healthcare providers can offer treatments that may help maintain cognitive function for a longer period. Stage 1. Preclinical Alzheimer's disease. This stage can last for years, even decades, before noticeable symptoms appear. In this early stage, individuals may experience subtle changes in memory and thinking that are often undetectable to themselves or others. These changes are usually so minor that they are often attributed to normal aging or stress. These changes may include difficulty remembering recent conversations or events, misplacing items, or struggling to find the right words. It's important to note that these symptoms can be intermittent and may not always be present. Stage 2. Mild cognitive impairment due to Alzheimer's disease. This stage is characterized by more noticeable memory and thinking problems that can interfere with daily activities. As the disease progresses to stage 2, memory and thinking problems become more noticeable. Individuals may find it increasingly difficult to perform tasks that require concentration and focus. Individuals may experience increased forgetfulness, difficulty concentrating, challenges with planning and problem solving, and changes in mood and behavior. These symptoms can lead to frustration and anxiety both for the individual and their family members. Stage 3 dementia due to Alzheimer's disease. This is the most severe stage where cognitive decline significantly impacts daily life and independence. In this stage, individuals experience significant cognitive decline that affects their daily life. They may require assistance with basic activities such as eating, dressing, and personal hygiene. Memory loss becomes more pronounced, communication skills deteriorate, and individuals may struggle with simple tasks such as dressing or bathing. They may also have difficulty recognizing loved ones in familiar places. Behavioral changes such as agitation, wandering, and personality shifts are also common in this stage. These changes can be distressing for both the individual and their caregivers, often requiring additional support and intervention. Recognizing the signs of Alzheimer's disease in its early stages is essential for seeking timely medical attention and accessing available treatments and support services. Early intervention can help manage symptoms and improve the quality of life for both the individual and their caregivers. If you or a loved one are experiencing persistent memory problems or other cognitive changes, consult a healthcare professional for a comprehensive evaluation. Early diagnosis can open the door to treatments and strategies that can help manage the disease and maintain a better quality of life for as long as possible. Thank you for making it this far. If you enjoyed or got value from this video, please consider hitting the like button, share the video, and of course we would love for you to subscribe. Until next time, stay healthy everyone.